Hi, I'm Dr. Karen Parmar, co-founder and medical director of Integrated Health Clinic. Today, I'm going to demonstrate how to do the pregnal or HCG injection, particularly when it's prescribed to you in divided doses. I have laid out the contents of the package that you were likely given by myself or one of the doctors here, which include 2 alcohol prep pads, cotton ball, 3 cc syringe and a drawing needle, and 3 other 1 cc syringes with needles for injection. This is the pregnal box, or HCG, often called, and inside there is a vial of water for injection and a vial of the powder in which the HCG medication is. We're going to start by removing the blue lids off of these 2 vials, taking one of the alcohol pads and swiping off the top of the vials to ensure that they're clean. You're then going to take the 3 cc syringe from your pack and the larger of the needles, the only one that is not attached to a syringe in itself. Put it onto the 3 cc and pull it back to just below 2 cc's or 2 mils. You will then uncap the needle, push it directly into the water for injection, invert, and pull out just over 2 cc's of fluid. The entire 2 cc's will then be pushed into the HCG powder. Needle will be removed and you will swirl to mix. To prepare the first vial, which will be 5,000 IUs or units of the HCG, you open the first 1 cc, remove the needle for injection, and recap it with the needle for drawing. Pull back to 1 cc, uncap, insert, push in the air, invert, and pull out. You may have to push it in a few times to get the air or the volume and the fluid. And pull back to 1 cc. Remove, recap, twist off the drawing needle and put on the injection needle, and your first injection is completed. We repeat again. For the second injection, remove, recap, pull down to 0.5, which will be 2,500 units of HCG. Push in the air, invert, and pull back to 5. If you have a little bit of air, you can just give it a little bit of a flick. You can push it back in until you have the 5.5 cc's of the medication. Number 2 injection is prepared. 5,000 IUs, 2,500 IUs. And the final needle is done in the exact same way as number 2. 5 cc's into the vial, push in the air, and pull out the remaining 5 cc's of the medication. You now have your 3 vials prepared, or your 3 syringes prepared, 5,000, 2,500, 2,500, and you will inject them as instructed by your physician.